Hello, my name is Harmony. I'm a PN student at Williston State College, and today I'm going to show you how to administer medications. I am outside the patient's room, and I'm going to confirm go over the provider order and verify it with my MAR. So I've got Miss Shirley Coast. Date of birth is 4/3/87, and it's Dr. Iston. Looks like we are administering her 9 o'clock medications, and most of them are for the pneumonia, and she's got a secondary diagnosis of CHF. Looks like refresh eye drops. We are doing 1 drop in each eye 3 times a day. That's for her dry eyes. Fentanyl, 50 micrograms per hour. Transdermal patch, twice a day. And she already had one on, and it's on her right shoulder, so we're going to be rotating that to her left shoulder. Then we've got, and that's for pain. Then we've got Augmentin, 600 milligrams by mouth, twice a day for 7 days, and that's for her pneumonia. And we've got ibuprofen, 800 milligrams by mouth, every 8 hours as needed for pain. So we're going to need to do a pain assessment. Digoxin, 250 micrograms by mouth daily, and that is for her CHF. And we're going to need to listen to her apical pulse and lung fields to make sure it's safe to give it. And we're also going to review her labs, make sure her calcium level's in a good range so that it doesn't cause hypo or hyperkalemia and arrhythmias. And now that I've gone over the MAR with the provider order, I'm going to go into the patient room and do an assessment. So I close out my MAR. I am outside the patient's room. I'm going to knock. As I enter, I will wash my hands. Hello, Shirley. My name is Harmony. I'm a nursing student, and today I'm just going to be giving you your morning medications. I'm just going to lift your bed up so I can talk to you here. Can you verify your name and date of birth for me? Shirley Coast, and your date of birth? 4/3/87, perfect. And I also note that she's got a promethazine with codeine ban on for allergies. Do you mind if I sit you up? Perfect. All right. So we are going to listen to your apical pulse and then some of your lung fields. That way we can know if we can give you your digoxin. I'm going to listen to the apical pulse for 1 full minute. Go to the midclavicular line, to the 5th intercostal, her apical pulse is 70 beats per minute. Now I'm going to listen to her lung fields. I'd listen to those for 15 to 20 seconds, and I'd also listen to the posterior lung fields. All right. Now, are you having any pain or discomfort? You're having some upper back pain? And how long has that been going on for? She says it's been going on since she got pneumonia about a week ago. Is there anything that makes it better, anything that makes it worse? Lying flat makes it worse. She says sitting up and taking ibuprofen for the pain helps. Okay, and on a scale of 1 to 10, how bad is it? Or what would you rate it? 0 being nothing and 10 being the worst pain you've ever had. She says about a 6, so we can give you some ibuprofen to help with that pain if you'd like. Okay, well, I'm going to go get your meds ready, so I'm going to lower you back down. Is there anything else I can get you while I'm gone? No? Okay. Do you want the bed left upright, or do you want to put it back flat? Upright? Okay. Here's your call light. Let me know if you need anything before I come back. I'm going to leave the room, wash my hands, and now I'm at the med room, and I'm going to go over the MAR and confirm it with my medications as I pull them out of Shirley's bin. So we've got Shirley Coast. Shirley Coast, date of birth is 4/3/87, and it's Dr. Iston, which we've got. Okay. And I see here her allergies are promethazine and codeine, which I saw on her wristband, but we'll also confirm when I go back into the room. So we're going to see refresh eye drops. We're doing 1 drop in each eye, and 3 times a day, and I'm only doing the 9 o'clock. Doesn't expire till 10/20/30. That's for her dry eyes. Then we've got fentanyl, 50 micrograms per hour. It's a transdermal patch, and we're doing it twice a day. Doesn't expire till 2064, and the first one is on her right shoulder, so we're going to be rotating it to the left shoulder. Then we've got, and that's for pain, Augmentin, 600 milligrams by mouth twice a day for 7 days. I'm going to shake it up, And I see here it's 400 milligrams per 5 ml, so I'd do a dimensional analysis, and that would be 7.5 milliliters. And that doesn't expire until 2023. That's for her pneumonia. We've got ibuprofen, and I did the pain assessment, said she needed some for her pain. And ibuprofen, 800 milligrams by mouth every 8 hours as needed for pain. We have 400 milligrams, and I know I'll need to give her 2. And it doesn't expire till 2036. And then we've got digoxin. So digoxin, we've got 0.25 milligrams and 250 micrograms. So I'll do my dimensional analysis, and that would be equivalent. And we're doing that by mouth daily. And it doesn't expire until 2036. So I did my first med check. I'm gonna go and do my second med check. So I'll pull out my med cups. And for the refresh eye drops, we've got 1 drop in each eye 3 times a day. Doesn't expire till 2030. And it looks like we could get 2 drops out of this one Refresh Plus eye drops. Then we've got the fentanyl, 50 micrograms per hour transdermal patch, twice a day. It's on our right shoulder. We're going to be rotating it to our left shoulder for pain. It doesn't expire until 2064. Then we've got Augmentin, 600 milligrams by mouth twice a day for 7 days. I did my dimensional analysis because this is a 400 milligram per 5 ml, so I'm going to be giving 7.5 milliliters. And we're going to draw this up. I'm going to go to squat down, go to eye level, shake this up good, put my palm over the label, and pour this. And you're going to read the bottom of the meniscus to make sure that it's right at that 7.5. And I only have 1 liquid medication, so I don't need to label it because I know that that is her Augmentin. And then we've got her ibuprofen, 800 milligrams by mouth every 8 hours as needed for pain. And we've got 400 milligrams, so she needs 2 tablets, and it doesn't expire until 2036. And then we've got her digoxin, 250 micrograms by mouth daily, and that's 0.25 milligrams because I did my dimensional analysis. It doesn't expire until 2036. All right, so I'm going to do my third and final med check for the medications that I can't take into the room with me. So I've got my refresh eye drops. I'm going to administer 1 drop in each eye 3 times a day, and we're doing the 9 o'clock one. So I've got refresh eye drops. Doesn't expire till 2030. Then I've got my fentanyl patch, twice a day. It's 50 micrograms per hour. 50 micrograms per hour. It's on her right shoulder, so we're going to be putting it onto her left shoulder. Doesn't expire until 2064. Then we've got Augmentin, 600 milligrams by mouth twice a day for 7 days. We have 450 milligrams for 5 ml, so I did my dimensional analysis and we measured out 7.5 mLs. And it doesn't expire until 23. And then we've got our ibuprofen. It is 400 we would need 800 milligrams by mouth every 8 hours as needed for pain. We have 400 milligram tablets, so we need to give her 2. And I've got 2 in her cup, and that doesn't expire until 2036. Okay, now I am ready to go into my patient's room. So I am going to bring my med cart with me. I'll need my alcohol swabs, tape, and then a rag to clean her eyes before the eye drops. All right, so I'm going to knock. As I enter the room, I'm going to wash my hands. Hello, Shirley. I'm back to give you your medications. I'm going to pull the curtain for privacy and make sure the meds are always in my sight. All right, Shirley, can you verify your name and date of birth for me? We've got Shirley Coast, date of birth, August 3rd, 1987. Okay, and it looks like we're giving you your 9 o'clock medications. How is your pain level? You're still at a 6? Okay, well, I'm just going to re-listen to your apical pulse. So I'm going to bring the bed back up. Okay. So I'm going to go down to the midclavicular line, to the fifth intercostal. I listened for 1 full minute, and I got 74 beats per minute, which means that we can give you your digoxin for your CHF. Okay, so now I'm going to do my medication admin. We're going to start with the Augmentin. So I'm going to get her a cup of water. And I already did my third med check outside the room, but I'm going to double check that my 7.5 mLs is correct, which it is, and that is 600 milligrams. All right, Shirley, so I'm going to give you this cup because she can hold her water. So she's got her water. Here's your Augmentin. This is for your pneumonia that you have. So she took her Augmentin. She took a sip of water. I documented that she took her Augmentin. Now we are going to give her ibuprofen. She said her pain's still at a 6 for the upper back pain. I verified that I did the third safety check outside the room, but I still see I need 2 tablets for 800 milligrams. All right, Shirley, here's your ibuprofen. Can you take both tablets at once? Okay, here you go. She took a sip of water. And then we've got your digoxin. And we checked your apical heart rate. It was good, it's above 60. We want to make sure that you're not going to go into arrhythmia. And we also checked labs. There's no indications that you can't take it. So I'm going to do my third med check in here. So we've got digoxin, 250 micrograms, which is equivalent to 2.25 milligrams by mouth daily. Doesn't expire until 2036. Okay, and we're administering the 9 o'clock medication. So we're going to open this and put it into the med cup. Okay, Shirley, here's your digoxin. This is for your CHF. And then she took a sip of water. Then we've got your eye drops. So we're going to do your eye drops. Do you want to lie down for that? No, it hurts too bad. Okay, well, we can do it sitting up, so we'll just hyperextend your neck. So I'm just going to move the pillow down, okay? All right, so now I'm going to wash my hands. I'm going to use a warm rag with water. We're just going to clean your eyes a little bit. Get the sleep out of them. Perfect. Then I put that in the dirty bin. Then I'm going to wash my hands again, grab some gloves. Okay, so we're just going to be giving you an eye drop, 1 in each eye. You said you've done this before at home for your dry eyes? Okay, so it's the same thing except that I'll just do the drops here for you, okay? So I'm going to open the top, just going to pull your eyelid down. Give you 1 drop. Perfect. Another drop. Good. Have you blink gently. All right. So if you tolerated that well, we're going to get rid of that. Now we're going to do our third and final check with the fentanyl patch. We've got fentanyl, 50 micrograms per hour, transdermal patch, twice a day. The last one was given last night, at 12 hours ago. The other one is currently on her right arm. We're going to rotate it to the left arm. And it doesn't expire until 2064. So before I open this, I'm going to remove her old patch. And I said it's on her left arm, so we need to remove it from the left arm. We want to fold it in on itself. And then put it into the sharp spin. Okay. Then we are going to clean that with an alcohol swab. Make sure there's no excess fentanyl getting absorbed. Okay, then I'm going to prep the site that I'm going to be placing the new patch on. So I get a new one of these, clean the site. You want to make sure it's not a site that has hair or anything like that. Then I'm going to open my fentanyl patch. So again, it's 50 micrograms per hour. The fentanyl patch doesn't expire till 2064. We're gonna write our date, time, and initials on this new patch prior to placing it on or removing it from the pack. Holding the outside edges, I'm going to apply the new patch onto her right arm with my name, date, and initials, or the date, time, and initials. Then I'm going to discard my gloves. I'm going to wash my hands, document everything that I have done. All right, Shirley, that is all the medications for you this morning. So I'm gonna lower you back down. Is there anything else I can get for you? Okay, well, I'm gonna be back in about 30 to 45 minutes to check on your pain and see how you're doing, okay? You want the bed left up or down? Up, okay. Well, here's your call light, and let me know if you need anything else. I'm going to take all of my stuff out of the room. I will make sure that I have locked the Fix-It, the Fix-It, and med cart's all locked. No medications were out of my sight. All meds were administered. She swallowed every one of them, and I documented all of them. And